Hi, my name's Charlotte Hesby. I'm a GP in the inner city of Sydney in Glebe. I'm also a long-term member of St Barnabas Broadway, and currently I'm the chair of the Royal Australian College of GPs for New South Wales ACT, which means that I've been having a fairly key role working with New South Wales Health and the federal government in terms of how do we manage COVID-19 in the Australian setting, and in particular for me in New South Wales and the ACT. Coronavirus is a very common virus, and it's actually the family of viruses that causes the common cold, and of which we're very familiar. The SARS variety of the coronavirus, however, is where this virus causes really acute, severe respiratory distress and sudden death, and as we're all aware of. And that's really what's causing the need to contain this particular virus infection. COVID-19 is what we call droplet spread. So the virus is spread from human to human via droplets, and those droplets generally come from our nose and our mouth as we sneeze and cough. The big thing is that they get transferred onto clothes, onto surfaces. We then pick them up on our hands, and our hands then transfer them back to our mouths and our nose, or from our hand to somebody else's hand. So the whole point about droplet spread transmission, that when we want to try and stop it, is we actually have to try and stop the spread of those droplets. So hence a whole lot of the strategies that we're being told to do at the moment, which is social distancing and social isolation. So at this point I'll just say, so it's very different from air transmission. So viruses like the measles, they do transfer via the air, which means that if I'm in the same room as you, I'm at risk of actually catching that virus. It's very different for COVID-19. I do actually have to come in contact with a droplet that has virus in it in order to actually get infected. So I can very easily be in the same room with several people who are actively infected with COVID-19, but because I aren't in close contact with them, don't come in contact with anything that has the virus in it, I'm completely safe. The concept of social distancing is about actually being mindful about this whole droplet spread. So 1.5 metres is sort of deemed to be that distance between people where if somebody unexpectedly did a big sneeze or a cough, that I'm no longer in range of those droplets and able to then unwittingly get infected. So that's the 1.5 metre rule. Some people say 1 metre, and hence the 1.5 is probably the safer bet. Then we're actually being asked to sneeze and cough into our elbows. Again, if you do that, obviously you're limiting the ability for any of those droplet spray to go anything other than in your elbow. If you cough onto your hand, then you're immediately giving your hand as an easy spreader of what you've just coughed onto it. So in your elbow, we don't tend to use our elbow crease for anything else, so it's a much better place to put those droplets. And then again, thinking about the hand, when my hand touches something, I can pick up the droplets that might have unwittingly been left there by somebody with an infection. I then put my hands on my clothes, it stays there. I then put my hand on my face and touch my mouth, or I scratch my nose, or I wipe my eye. And again, those are the three main mechanisms by which I can transfer the droplet virus into a portal of entry that then I absorb, and then the virus can actively grow and infect me. Social isolation is basically taking yourself out of the general routine of your life and keeping yourself away from the majority of people. Now, for some people, that may be quite difficult. If I live in a household with a partner and children, exactly that question, what do I do? I think basically the answer is you just accept that you've probably already had enough contact with them for them to already have been potentially infected, and you just get on with your life. And the current rules is that they would also have to socially isolate with you anyway. So all of you then just basically live a normal existence, if you can call it normal, when you're not really going out and about. And so the not really going out and about means not going out your front door, but you can do anything around your house, go into your garden and organise for things to be brought to you. If need be, and you do actually have to go and be seen somewhere, then you actually need to make sure that you've washed your hands, you've got a PEP mask on so that you're unable to, again, unwittingly spread the virus through coughing or sneezing, and go in a form of transport that doesn't put other people at risk. So that may well be in a taxi or an Uber, but you're in the back and you make sure that it gets wiped out after you leave. One of the really important things to understand about COVID-19 is that it's actually quite different from influenza. And I think a lot of us, because the symptoms are extraordinarily similar to influenza, we're sort of relating to it as being the same disease. Influenza does actually affect babies and children, and babies are as vulnerable to getting very sick as the very old in that illness. COVID-19 is actually quite different. It doesn't seem to cause very much illness at all in the very young. And in fact, often we're seeing that they seem to be asymptomatic, but they do have evidence of having had an infection. So that's the nice thing, is that we can actually be quite comfortable in knowing that our children and our adolescents are quite safe with this illness. The problem is the vulnerable populations who are getting very sick and are at risk of dying, and that's the older you get, and if you've got other illnesses. So the more extra illnesses that you have and the older you have, the more vulnerable you are. So those are the people we need to be particularly mindful of protecting at this time. So for children, not only do they not seem to get very sick, they also don't seem to be shedding the virus much either. So even those who are infected aren't as infective as adults. So we've got some papers coming out. It's a bit of an emergent story, because this virus, as I speak, is only 14 weeks old. So it's a very new thing, and we don't, not all the evidence is out, but what we see, children don't put out so much virus, therefore they're not as actually infective amongst themselves, and they don't get as sick. Oh, look, I've heard all sorts of reactions from, oh, what are we fussing about? This is just another form of a cold, right through to people being, talking about it as being a totally catastrophic event. I think it's fair enough to say that this is the most severe infection I have ever faced as a doctor. Not that the infection itself is the most severe, but it's the first time I've actually had an infection that's at risk of infecting the whole of our country and causing so many people to die if we weren't to actually bring in measures to decrease the number of people who are infected. The last time realistically we've seen this is probably the Spanish flu, and I wasn't around at that time. So this is also the first time we've had social media and a sort of a connectivity with the rest of the world to really understand what's going on. So we do know, when we look at Italy and South Korea and China, that this is not an insignificant event, that the people who get really sick are going to get really sick, and there will be a huge pressure on our healthcare system. There'll be a huge ethical dilemma if we're unable to cope with the number of people who require intensive care units and ventilation to be able to keep them alive, and there will be a significant number of people who die. So the strategies that we're putting in place are to have an understanding that, like it or not, we have the infection in our community, and that yes, we're going to see an increasing number in Australia of people who have that infection. What we want to do is slow it right down so that we are able to cope with it at a health system level and ensure that all the people who need to receive the care that they need can receive the care that they need, and in fact that we can try and keep as many of our vulnerable populations away from being infected as possible until we're actually at a level of about 50 to 60% of the community having had the infection, at which point then the large numbers of more cases will drop off rapidly. If we have our way, we've got 6 months ahead of us. And we'd like to have our way, but that's the bad news. We actually have to look at doing all of these measures and being really, really good about these measures for a long time. And as I said, that bottom line is about trying to protect the older and the sicker people who are in Australia, who I'm sorry, but they deserve protecting. I think that small groups are a great way to continue with social networking, and social networking is a really important part of both church community and actual mental health and well-being for our society. And at this time, that's really key and really crucial. So that gets down to how can you do that safely? And I think each group needs to actually sit down and have a discussion about what that looks like and what that means. They need to be upfront about saying the minute anybody had any symptoms of a cold or a flu that they would stay away from the group. That on entry in the group, everybody washed hands and was able to feel comfortable about the way and the distance that they had sitting from each other. If you've got couples, they're obviously sharing, they're close contacts anyway. So as I said, it's sort of about deciding what are the rules of that group. So it may well be that there are some people who aren't comfortable, whatever rules you set up, to come, and others whom will be really grateful to be able to come knowing that there's some safety rules around how that meeting is set up.